Today we get an opportunity to look at different healthcare opportunities. It's really exciting to see how many there are in the first place and how they vary differently. I think that's really cool.
I think for me personally, I'm interested in learning more about healthcare in general.
At the nursing home that I work in activities, recreational therapy aid. We do crafts, we go outside, play card games.
Hey guys, how we doing?
Good.
Good.
Welcome to the OFC PT Clinic. My name is Garrett, I'm a physical therapist here at OFC. What's your guys' name?
I'm Tyler.
Tyler?
I'm Jacob.
Jacob?
Izzy.
Izzy? Nice to meet the three of you. This is Daniel. We're just working on some hip strengthening over here. I know you guys are in here touring some different careers, and we're here today learning a little bit about physical therapy. So what are some questions you guys have for me regarding the rehab process?
What sort of exercise is Daniel doing right now?
So right now, Daniel's working on hip extension. So he's strengthening his glutes, doing some proximal strengthening up top. Daniel sustained a knee injury some months back, and so now we're working into some proximal strengthening as he works back into transitioning to sports. We want to make sure he's stable up top so we don't reduce the load on the knees.
How long does it usually take for someone to fully recover?
From an ACL injury, it depends on what their goals are, right? If they're looking to get back into sports, they could be seeing rehab from anywhere from 7 to 9 months would typically be that range before we're even thinking about returning them to sports. Earlier than that, sustaining a re-injury, the risk of that is substantially higher. So we like to wait around that range.
And how long have you been a physical therapist here?
So I've been working here at OFC for just about 8 months. So this was my first job out of PT school, and it's been a great experience to start out because everyone here has a ton of experience. I've been able to ask questions when there's things you just don't learn in school. You don't learn everything in school. A lot of times you learn on the job. So I've had great resources here, able to ask a lot of questions. Everybody's been more than willing to assist me along the way, and I hope that continues because I have a lot more to learn.
Getting a good look at the backstage of the medical field here has really opened my eyes to sort of how I want to do things.
And what's the education like to become a physical therapist?
Typically the progression is a 4-year bachelor's degree, and you can do a number of different majors. My major was exercise science. So I got a bachelor's degree in science and exercise science, and then 3 years of PT school. Now there are programs that speed it up a little bit, 2.5 years, but the typical model is a 4-year bachelor's degree into a 3-year doctoral program. And throughout that process, we have a didactic, so just classes, sitting through lecture, learning from them, as well as clinical rotations, where we'll go into various sites, and we have students in here that come through where you can learn the day-to-day process. And it's a real nice culmination of what you learn in class and what you learn on the job. Because as you guys will learn going into different professions, you learn a lot in class, but you learn a lot more on the job.
Is this what you wanted to do when you were younger?
So I've changed career paths a couple times. Initially, related, I wanted to be an athletic trainer. So my high school, we didn't have an athletic trainer. I always felt like it'd be beneficial. But as my progression in school went, physical therapy just kind of called it rehabbing young athletes and all types of populations. The diversity of physical therapy is something that really drew me in, because it's a lot more than orthopedics and sports medicine. There's a number of different areas, neurology, cardiovascular. There's a number of different areas that you can get involved with in physical therapy, and I think that really drew me in as well. My initial proclivity was because of sports and rehabbing athletes, but the diversity of it is pretty incredible. All right, and to finish up that last rep there, so now Dan's gonna move on from the hip machine, and we're gonna move over here to the leg extension, leg curl machine. So why don't you come over here, Daniel? All right, now have you just take a seat in there, slide in there, rotate around, and your feet are actually gonna go behind that there.
So for certain injuries, there can be more than one machine or part of physical therapy to help heal that?
The thing about sustaining an injury is it's never just in one location, right? This is a whole kinetic chain. So even with like an ankle injury, for example, we're not just gonna focus on the ankle. We're gonna focus on strengthening the knee, we're gonna focus on strengthening the hip, strengthening the core. In Daniel's case, he wants to get back to playing sports. So we need more than just leg strength, right? He needs to strengthen the core. So we'd use various core exercises as well to strengthen that trunk so he has control as he comes down from a jump landing. Or if he gets knocked off balance, right, he can come back because he has sufficient core strength for it. So we work for global strengthening. Obviously there's muscles that are a little bit more dialed in than others when it comes to that injury, but we want to strengthen globally as well.
Are the bikes one of your favorite machines here?
I think it's a great warm-up tool or end of a session tool. Now we can work that in pretty seamlessly to start a session, get the blood flowing, warm up the body to get started before we transition into strengthening. All right, so this machine here, this is called a Biodex balance machine, and we use this with a various amount of patients. Most frequently we use it with athletes who are starting to relearn proprioception. And proprioception is just basically awareness of where your body and your joints are in space, what muscles you need to use to stabilize. So the cool thing about this is we can adjust the level of resistance on there and how much that bottom moves, and they have to adjust to where their weight shift is to maintain their balance. So it's a great tool for proprioception and balance.
Is there like minimum or maximum amount of weight you can use?
So the weight we put on the bar is the weight that we're using. And we like to use this before we transition into a full barbell with different movements like a back squat. And we're kind of stabilized within the machine. We see great mechanics there, looking at frontal plane motion. Everything looks sound there. At an increased weight, we know we can transition them more into a free weight utilizing a barbell. I think at the end of the day, the thing I love about physical therapy is improving patient quality of life. Now, people come in here with a variety of injuries. They're not able to function throughout their day as well as they would like to. Some ailments are worse than others, but they came in here because they want to improve how they interact with their environment and what they're able to do throughout their day. And I think that's the best, most enticing part of physical therapy for me, is knowing that I was able to improve someone's ability to interact with their environment and the joy they get out of their day.
I think the number one thing that scares me is just how big the healthcare field is and finding out where I want to be in it.
Hi, I'm Stacy Haug, and I am the MRI director at the Orthopaedic and Fracture Clinic. And today I'm going to give you a little tour of my world. Hi guys, come on in. How are you today?
Good, how are you?
Good, good. Welcome to MRI. How many of you have ever had an MRI before?
I've
No.
had one, no.
Okay. Do you know anything about MRI?
I know that's a really strong magnet.
You're right, it is. It is a very strong magnet. So they kind of take our different types of machines. We have two different types of machines. There's an open-sided that's a lower strength of a magnet, and then there's a closed one over here that's a stronger strength of a magnet. Kind of an average strength of the magnet is equal to about 10,000 times the Earth's magnetic field. When a patient arrives to have an MRI at the Orthopaedic and Fracture Clinic, we will bring them back and have them change and perform their MRI. They will be with us for approximately 30 to 45 minutes. So to have an MRI, if a doctor orders that, they're having to come to check out, to kind of look at that body part internally. It shows basically everything that's inside of there. They're looking at all of the muscles, the tendons, the ligaments, compared to an x-ray. So an x-ray basically just shows the bone. This is going to show all of that anatomy so they can see if there's anything going on like that. You basically go and you lay on the table for about 30 minutes average. For the length of it. It's very noisy. It's going to sound like a jackhammer, so it's very loud and knocking. That's just the physics behind how that works inside of there. There's different gradients that are vibrating and creating all of that noise. You have to lay very still. It's very sensitive to motion, so your body has to just be very still throughout the whole procedure, or the images can get very blurry. And then you usually get some headphones with music to protect your ears and give you something to listen to while you're laying there. It's pretty painless. Kind of the main thing sometimes we deal with, though, is people that are claustrophobic. So they might have a hard time being in a closed space like that.
How do other areas of healthcare use MRIs to help their practice?
They do use it so it could go from what they see on the MRI maybe to what their next step is going to be as far as therapy. So a lot of times, and if they see something that doesn't need to have surgery, then they might just continue to go over to PT, physical therapy, and to continue to try to strengthen and relieve some of the symptoms that they might be having that way if they don't need to have it surgically fixed.
What's the schooling behind going into this field?
Schooling for, it's radiology school, so you actually begin there for diagnostic x-ray school. And most of those programs are either a 2-year or a 4-year, kind of depending on where you go. A lot more kids are now going more towards the 4-year just to get that bachelor's degree also with it. You can kind of take it in different areas then. Once you are done with that program, you have to get your certification. So you take the test to pass your boards to be a certified x-ray tech. Then there's lots of different ways you can go from that. You can go to MRI, you can go to CT or CAT scans, ultrasound, nuclear medicine. There's many different kind of avenues that you can take from that. And then each of those have their own, where you may just get a job and do on-the-job training, and then you also have to take again the test to get certified to do that modality. Yeah, so then we also have to be very careful about anything that we bring into the room as far as equipment. So we have all of our own MRI safe wheelchairs and gurneys and IV poles and such. So we have to make sure we have all of that that's made for the MRI department.
What other technologies do you use besides MRIs?
So here, just MRI. Through our facility, we also have a radiology department where they do all of the x-rays. Here at this facility, we don't. But again, at a lot of hospitals, then you're going to have all of those same, where you have the CT and the ultrasound, nuclear medicine, a lot of those. But yeah, here we just do the MRIs. So.
What made you choose this field personally?
Well, it's been a long time ago, but kind of back then I knew I didn't really want to do a 4-year program or schooling, so this I kind of worked, came and got to job shadow and watch somebody that was working in the radiology field through actually the Orthopaedic and Fracture Clinic, and I just kind of liked that setting of working with patients. And then there's a lot of different settings that you can work in, obviously, again, between a hospital setting, a clinic setting. There's lots of different variations between those types of jobs and what type of patients you'll be working with. You know, there's a lot more if you're at a hospital that's involved with a lot of inpatients and emergency room patients and such, versus a clinic like this where it's pretty much the walk-in clinic. So you have a lot of variety from different choices of what you're looking for. Okay, so yes, we have 2 technologists that work here that are performing an MRI here, right here, that you can see. So this is our open-sided scanner. If you can kind of see how the difference is between the closed scanner and here, the patient has quite a bit more room inside of the open-sided here. One thing about MRI, after we've talked about all of this, is to realize it's not as scary as it may seem. It is a wonderful pathway to go into the medical field, and again, it kind of shows you that there's lots of different avenues that you can go from becoming a radiology technologist to an MRI technologist.
It's just inspiring for me to see how helpful that I could be to someone someday.
I think for me, healthcare is very important because I can give back to my community and help other people around me.
I think my game plan after school is to stay in the town that I'm currently living in and slowly build up my skills to prepare myself for college.
If I were to go back and tell the high school version of myself about this field, I think I would probably be surprised to learn at how rewarding it can be. The amount of satisfaction that you get from working with the patients is wonderful. The amount of people that you get to learn from and enjoy each day has been wonderful.